My name is Dr. Matthew Standridge. I'm a private practice dentist here in Yates Center, Kansas. Orthodontics has been a big part of my practice. Basically, when I got right out of dental school and went into private practice, going rural, I learned how important providing orthodontic care was going to be for my patients in my community, as there are no orthodontists around us. That's what got me started with orthodontics. I started with straight wire and did that exclusively for quite a few years. As the demand of aligners grew, that's what got me into learning more about aligner therapy, and then it just kind of snowballed from there. And took a lot of courses, tried a lot of different systems, and over the years have kind of amalgamated best practices that I've learned from various techniques and teachers and different pros and cons of different systems. Our Digital Aligner Bootcamp was to teach orthodontics first and then aligners second. And it's not talking one single system, but it's really designed to be kind of core foundational principles that can be utilized across any system. So I started with aligner therapy almost 10 years ago. Through trials and tribulations and frustrations, I've kind of tweaked my systems over time. And nowadays I use Invisalign. I do a little bit of SureSmile, and then I do my own in-house aligners as well. We 3D print our own models and design and make the aligners here in-house. And there's pros and cons of that, but that has given us flexibility as far as cost savings and overhead control to offer more aligner therapy to more patients than we could otherwise using other systems. So my course with the Digital Aligner Bootcamp was really focusing on orthodontic foundations and principles first. That's good for anybody. I don't care if you've been doing orthodontics for 20 years or if you're fresh out of school and this is your first foray into orthodontics. That's where we start off with is proper diagnostics and proper record taking and getting the foundational orthodontic principles in check. Then from there, that's when we go into how aligners work, the actual biomechanics of aligner therapy and how that's different from straight wire. And so that's actually the focus of the second half of the first day, is all about aligner mechanics. When to use attachments, when to do concepts around overcorrection, how to troubleshoot the most common frustrations that people have with orthodontics or with aligner therapy, why that happens in the first place, and how to mitigate it from happening to begin with. And then in day 2, that is where we go into case reviews, working up actual cases and showing the process of cases that I've treated over the years, each one with its own little bit of nuance. And then we also make time to go over case reviews of the students. So we encourage students to bring their own cases, photos, log into any aligner portals. And then we also recommend that we make some time for going over troubleshooting. So if people also have cases that they're frustrated with, I want them to bring those and maybe we can troubleshoot them as a class as well. And then in the afternoon, that is where we do hands-on. We utilize a software called Blue Sky Plan that has an orthodontics module that's available to anybody who wants to use it. And we go over actual case workups of sample cases that almost anybody could treat there in the office if they wanted to. After this class, you will be able to predictably and efficiently screen your patients on who's going to be a good candidate for aligner therapy. So yes, in the course, we do cover a lot about enrolling the team. I'm all about delegation and anything orthodontics. For it to be fun, for it to be profitable, for it to be efficient, it needs to be delegated to your team. In orthodontics, there is such a demand in every practice. It's estimated anywhere between 75% to 90% of our patients could benefit from orthodontic treatment. And then with the marketability of clear aligners, how that's exploded over the years, there's more demand for it from the general public now more than ever. But being able to offer that and offer it efficiently and still profitability and getting the results that we need for our patients, that's where the challenge is. And that's what sets this course apart from some of the others, because it is results driven, it is foundations driven, it's about true orthodontic knowledge and not hawking one particular system.